Approximately 2 years ago, we recognised that patients who are at the end of their life and their relatives weren't getting the best experience possible. We were very fragmented in the way that we delivered the care, and so various departments came together, including the end of life care team, the palliative care team, the pastoral service and the bereavement service came together and implemented many new ways to make the experience for patients and relatives at the end of life much better and improved.
The work really started when patients told us that we didn't do it terribly well. They asked us for more information and to make sure that the pathway was much more streamlined. So the team sat down and really focused on what that meant to patients and their families, and we came up with the DAISY scheme, which is really simple, very cost effective, but has had a significant impact on the patients and their families. So when a patient in this organisation is getting towards the end of their life, we have signs on the doors, which are our lovely daisies, which tell people in an obtrusive way that this patient is towards the end of their life. That daisy follows through their whole pathway. So as the relatives leave the ward, they have a bag with a daisy on, so that other staff in the organisation know that this is a bereaved person. And that follows through to the daisy centre, where people come to get the death certificates, and down into the mortuary. So for the whole of the pathway, we recognise patients and their families.
A lot of patients and relatives and hospital staff are a lot more aware now that when the trolley go past, that there is a deceased patient there, so they're a lot more respectful, and it's a good change.
It's had a significant impact on our feedback from patients, and it's something that we're really proud of in this organisation.
A lot of the work we've done has been around how we look after relatives after a death in their family, and we knew that that could be made better. I had a lot of feedback around the process now for coming in, for collecting death certificates, for doing the administrative tasks that are required once a patient's died. And we've made that a lot more simple and a lot more friendly for relatives. It's a really difficult time, and we recognise that, and having to come back to an area where maybe your loved one has died can be quite challenging. So we've made the areas as calm, as peaceful and as holistic as possible to ensure that that process is as dignified and respectful as it can be.
Once the death has to be registered, we have that all completed in one centre now, so they don't have to go to various different places. And that used to be behind 2 or 3 security doors, whereas now it's in a lovely, warm and welcoming environment. And that's been led by our chaplain, Phil, who's been able to instigate those changes.
It's just much more easy now for families to come to just a one place where they can speak to a member of the bereavement department to talk through what's on the medical certificate. It's literally just next door to the same office for the registrar. And when they come in, they are given a card now, which is also the divisional nurse of where their loved one was last in hospital. And this is a condolence card as well, which also they will get a week after the person's died. Because of the environment that we're now in, and there's chaplains available as well, we can sit with people and spend time with them, talking through some of their issues and even just holding their hand through this process.
End of life care focuses on the patient, but also we have some quite distressed and grieving relatives that also need our support, and we have to prioritise elements of care for them as well, making sure that they're able to have regular visiting, they can stay as long as they need to, they can stay overnight, they're offered tea, coffee, hot meals if they've been staying for a long time, somewhere to sleep in the room. We now have 2 chairs that go into beds that we can wheel into rooms for relatives.
We survey the relatives 12 weeks after they have lost their loved one, and what we've seen is a really tremendous shift in the feedback that we are getting. It used to be quite negative, the feedback, because we didn't have the processes and systems in place, and that's moved to the majority of our surveys now feedback very positively, not only on the scores but on the comments that we receive. And we have some really passionate, lovely comments that we receive, that we feedback to the staff about how they've made the experience of losing their loved one better for the patient and the relatives.